He owns a practice, I believe, up in Davie. Went to dental school at Nova.
No, sir.
UF.
UF.
He went to UF.
Right.
I'm
in Nova's backyard, but I studied in Gainesville.
I failed the test already. But this Dr. Alex, he came to visit us last year. He also has a program which will tell you guys all about called DMD Bound, which is a program for pre-dental students to help get to dental school essentially. But it is very generous of him to give his time this evening again to help to come speak to the members here. He is an alumni of FIU. So yeah, the floor is yours, Dr. Alex.
Thanks, Alex. Well, guys, very excited to be here. Hopefully going to share with you guys some interesting stuff, some tips and tricks. And let me get my screen shared here. And let's make sure that you guys, how does that look? Everyone see my screen there?
Yes.
Awesome.
Great. Yes.
All right, guys. So here's the agenda for today, so to speak. I won't bore you guys. I'll keep this moving, right? I know we all have to watch the Panther game later on, so I won't hold you guys up. So we're going to talk a little bit about why dentistry, why it's such an awesome field. Just going to touch on my personal career path, and also alternate paths, right? Just mine is just one story, but there's many, many different ways to practice dentistry and make this an incredibly rewarding career. We'll talk a little bit about chasing your dream, and then we'll close it out with some tips for interviewing. I know all of you guys are at different stages of your pre-dental career, but some of you are in the stage where you're either gearing up and practicing for your interviews or waiting to hear back from schools regarding your interviews. So we'll touch a little bit on that, and then we'll close it out with some Q&A. All right, so why dentistry? The big question, right? You guys hear this like 1,001 times a day. Everyone you tell that you're a pre-dental student to, they say, well, why do you want to be a dentist? And there's a bunch of different great answers for this. And really, the answers are as varied as we are, right? Like everyone has their own personal reason why they want to be a dentist and why they want to be a great dentist. So a few of the more common reasons is clearly it's a life-changing service for patients. We get to impact people's like immediate life on a daily basis. Their self-expression through how confident they are with their smile, their ability to function, you know, like I always say that I'm a doctor of smiling and chewing. So being able to restore someone's function is incredibly powerful and life-changing. Being independent in your career, kind of, you know, dictating how it is you want to practice. Clearly, earning a good salary, right? We all want to provide for our families. Flexible lifestyle. You know, there is a lot of that in dentistry, certainly compared to other careers in the health professions, you know, being a physician. As a dentist, you don't have to worry about being on call. You don't have to worry about being pulled away from the table on Thanksgiving dinner. You know, some patient is having a serious crisis. Now, some of the less discussed ones can be shaping the future of oral health care. You know, a lot of us will decide to go into branches of dentistry where we'll get to have an impact on legislation, for instance, and access to care and things like that. Be a respected member of society. You know, even though some folks don't consider us doctors, you know, we're just dentists, but we are doctors and we hold that distinguished place within the society. Working as part of a team. You know, a lot of you guys, you know, have either belong to a team in your current jobs or in athletics or things like that. And you guys know the power of working together and how much more reach we have when we're a strong team. And not to mention, you know, performing charitable care in the community. As dentists, we have the privilege and the responsibility, right, to help people who need our services. We have a very, very distinct skill set that no one other than a dentist can help with, right? If someone has a toothache, they have to go to a dentist. And I don't know if any of you guys have ever had a toothache, but it is debilitating. And there are folks out there that just don't have access to regular routine dental care. Being in a position where we get to help those people on a pro bono basis is a very, very powerful and very compelling reason to go into dentistry. So it's an awesome gig, right? Everyone in this room wants to be a dentist. I was in that room at one point too, wanting to be a dentist. And it's a great job. The new US News jobs report that came out in the year 2020 ranked it the second best career to get into. And they do these studies every year. And they use factors like compensation, lifestyle, the amount of debt that it requires to get into the career. So they use all these different metrics in order to rank professions. And general dentistry came out number 2 on the list. Number 1, curiously enough, was computer programming. But yeah, I'll stick to smiles personally. So like I said, we all have our own personal reason why we want to be dentists. As many reasons as there are people who want to go into the field. Now, it's super important throughout the entire journey to keep very present what your personal reason is. And fully expect it, guys, to transition and evolve, throughout your pre-dental to dental student to dentist to old dentist career. That why is probably going to evolve. For myself personally, when I was a pre-dental student, the earning a good salary and independence was a prime motivator. I honestly didn't have a whole lot more point of reference, but after I started, my career and learning about dentistry and actually getting to practice dentistry first as a dental student and now as a practitioner, that why has evolved into the impact that we get to have on our patients' lives and the lifestyle flexibility, spending time with my 2 best friends on the left there, my wife and my son, Jordy. That's huge to me. So designing my ability to practice in such a way that maximizes my time with them is paramount to me. Now, I don't in any way want to come across like I had all of this figured out from the get-go. I most certainly did not. These are the exact words that I heard sitting across the desk from a pre-health advisor at FIU. Just going to leave it at that. I'm going to remain nameless because I'm not sure if she's still there or not. But she point blank told me I would never get into a dental program. And those were tough words to hear, folks. It really was. I was not a stellar applicant. I was not a 5.3 GPA kind of guy. I son of immigrants, first gen, like a lot of you guys in the room here, kind of had that drive that you got to get a degree, you got to get a good stable job because your parents came here for you to have that opportunity, right? So I kind of sensed that pressure the whole way through. I kind of took a meandering undergraduate career. My first 3 years of a lot of finance and economics, I thought I wanted to go into that arena. And then I switched over to the sciences after I made the decision to go into dentistry. And I had a really average GPA when I graduated. Somewhere like 3.4, 3.5. Maybe that's being generous. My DAT was very average as well. The high teens, maybe a 20. So really the thing that kind of gave me a little bit of an edge over other applicants was my experience and my personal story, right? I was always loved being a teacher. I tutored my way through undergrad and had a business doing that. So I really sort of relied on my experiences in that arena and passion for teaching as something that I discussed a lot in my personal statement and in my interviewing. Now, I was a member of like I said before, the FIU Pre-Dental Society from 04 to 06. That was the logo back then. And just for a little bit of point of reference, that was pre-iPhone. This is literally what my phone was when I was applying to dental school. So check out those sweet, sweet graphics there, right? Like Instagram was a no-go on that thing. But like I said, and like Alex said, I did end up going to the University of Florida College of Dentistry, class of 2010. In my opinion, best dental school in the nation, but I may be a little bit biased on that front. One thing I do want to mention here, guys, and I'm sure that you guys discuss this with, and all of the resources that you look into as far as applying to dental school and all that, don't get hung up on the particular school. You can get an amazing education and a super crappy education at any dental school in the country, right? Like education is really a lot of what you make of the experience, right? You can take a lot from any school, and really dental school is a license to start learning dentistry. Okay, I'm sure you guys have heard that before, but it is very, very true. All right, you really just get the foundation to then go into the real world or a residency program and really start developing your knowledge base of the profession. So my particular situation, after I graduated in 2010, I started off thinking I wanted to go into oral surgery. So I spent a lot of time in the oral surgery clinic as an undergrad, really kind of soaking in scalpels and sutures because that was my bag. But then as my career in undergrad developed and kind of wound down to a close, I realized I really didn't want to be stuck doing the same thing all day, every day. I enjoyed the variety of the lifestyle of a GP, of a generalist. So after my 4 years, I decided to go out into the workforce. And I did what I call my speed residency. I didn't do a formal like AGD or something like that. I worked in a managed care facility sort of environment, seeing 35 to 40 patients a day, which when you're transitioning from dental school where you have one patient in the morning for 4 hours and one patient in the afternoon for 4 hours, you learn the fundamentals and all that, but speed is an issue. And in the real world, if we're seeing 2 patients a day, unfortunately, we're not paying the bills. All right. So the managed care facility was a very high volume sort of environment, seeing a ton of patients. And it helped me not only develop speed from a clinical procedural standpoint, right, but from a relationship building standpoint. Like what makes dentistry unique as a profession is that we are maybe the most personal of the healthcare professions. Like we develop very intimate, close relationships with our patients. And, patients don't really know if we are good, quote unquote, dentists or not. They don't know the quality of our crown preps, for instance. They just know how we make them feel. Right? So being able to develop those relationships with patients sometimes more quickly, right, than the 4 hours that you would have in dental school is also an asset to us moving forward. So the speed residency, those managed care facilities tend to attract a lot of younger dentists, and they do so with a very high volume, and they sort of lure you in with a really nice compensation package. So a lot of you guys, as you graduate dental school, will have great offers from these settings to kind of get your professional career going. Now, after a year, though, I was almost burnt out. That 35, 40 patients a day, 5 days a week is tough, guys. That's really, really hard. So after that 1 year, I decided I wanted to start designing, how I was going to practice tomorrow. And I literally did a Google search, dental practices for sale near me. And literally found one that I could afford, right? Which I'm sure you guys will be shocked, was not the practice I wanted to have. It was the practice that I could afford, right? I knew that I wanted to get started with very little debt. From a business standpoint, I didn't feel like it was wise for me to be in a position where I was going to have to learn how to run a dental business, right? Because you do, when you own your own practice, now you're a dentist plus a business person. And I would be in the position where I would have to learn both at the same time. And if you have to learn both at the same time and you're super stressed about, paying your monthly rent, that can be a recipe for disaster. And it really has led a lot of my classmates who graduated along with me down really, really stressful paths in life. So, being smart with your money, being smart with how you approach every next step from a financial standpoint is really important. So a little bit about my practice today. It's called Summit Dental. We established it in 2011. And I very much say we, because it may be my name on the door, but it is a team effort, y'all. Like, we get way too much credit as the dentist for everything that happens, both good and bad sometimes. But it's really the team that drives a successful practice forward. So my practice is focused on, it's a general practice, and we perform a lot of implants. Like, we have a strong focus on implants and adult orthodontics. We provide comprehensive dentistry. My schedule is currently 3.5 days a week. Although the practice is open a little bit more than that, it's basically running hygiene and other services. We're very much technology driven. 3D x-rays, CAT scans, intraoral scanning, things like that. And I honestly get to go to work with a great group of people every day. If I can give you guys one piece of advice for maybe not the dental school stage, but the dental practice stage, is invest heavily in your team. If you guys do decide to go into practice ownership, it makes all the difference in the world. I can rely on my team to take care of our patients and do, specialized services that, unless you put the work on the front end and train those people to do those things, you end up having to shoulder a whole lot more of the load. My team kind of jokes around. They call me Dr. Delegation, because I like to empower people to do as much as they effectively can. That I feel like that's my role as the leader of the practice. Like, have folks participate. And thankfully, that's led to us having raving fans in our patient pool. It's, you guys have all heard that old thing where, dentists commit the most suicide of any profession in the world, and this, that, and the other. And although I've never seen any hard and fast statistics to corroborate that, I'll tell you, if you're having to perform dentistry, which is kind of a stressful thing, on a bunch of patients that begrudge you for it and are just like not happy with anything you do, it can make it really, really hard to get up and go to work in the morning, guys. So developing a culture where patients are fans of what you do and your team and your facility is huge. It's huge. So to give you guys a little glimpse into what my personal average clinical day is like, we call a clinical day, as a practice owner, I call it working in the business, right? So I am Alex Semide. I am the owner of Semide Dental, but when I am there, I am Dr. Alex, employee of Semide Dental. And that's a really big, important distinction to create in your own mind. You have to treat yourself as an employee, and just because it's your name on the door doesn't give you shouldn't give you, I should say, the right or the empowerment to do whatever you want all the time, right? Like as a business, you set forth rules and regulations and expectations for every job description, including the dentist. And when you are there and you've got that white coat on, you're the dentist and you have to live up to that job description, right? So we call that working in the business. So my average clinical day is I see about 4 to 6 patients per day. I really like to have a nice mix of services. So that may be, placing an implant in the morning, doing an ortho check, maybe a new patient evaluation, and then perhaps a bridge prep in the afternoon. So the way we handle our schedule, and this is a schedule management theory that we use in the practice, is the rock, sand, water approach. So think of your schedule for the day as an empty jar, right? We are going to start filling that jar strategically with rocks first. All right. So what does that mean? Let's say we're planning out our schedule and we're telling our scheduling coordinator how to design our day and how to lay out and schedule patients in a way that we see fit. So for instance, production blocks are our rocks, and a production block is a big procedure that leads to a lot of production. So things like implants or crown preps or root canals or things like that, they're usually bigger procedures that yield more production, more revenue for the practice. So we'll start laying out our day and designing our schedule with 1 or 2 of those big production blocks. And those are our rocks in the jar. And then around those rocks, we fill in with sand. And sand things can be like a new patient exam, right? Or an orthodontic check, or maybe a couple of smaller fillings, things that generally take 20 to 30 minutes. They're medium-sized production, really not enough to schedule your entire day around, but nice boosts to the daily production and, providing services for patients that need it in a way that doesn't clutter your schedule. And then around those rocks and sand, we pour in water, right? And water procedures are very simple, generally quicker type things. So maybe that's a monthly Invisalign check, right? Or maybe it's a hygiene POE, or a periodic oral evaluation. So when you get your checkup, when you go to the hygienist and the doctor comes in, that's called a POE. And that's something that has to be scheduled in on the doctor's side too, because even though it tends to be a quicker sort of checkup, that takes the doctor away from those other bigger production events that are going on in the office that are the ones that keep the bills paid and, everyone happy. And of course, we have a lot of treatment planning. So a big chunk of what we do as doctors is think, right? Think based on each individual patient's situation, how can we best help? There is no one answer fits all when it comes to dentistry and healthcare. We have to take multiple factors into consideration when we devise a treatment plan to help get our patients where they ultimately want to be. So we have clinical days and we have admin days, right? And this is what we call working on the business, right? So designing your dream practice takes a heck of a lot of work. It goes way above and beyond just showing up every day with your white coat on and doing really great clinical care. So things like marketing, right? Financials, clinical protocols, facilities, HR, those are all things that as a practice owner, we also have to worry about. That's that flip side of the coin, right? So on one side, you have the clinical day-to-day working in the business. On the flip side, you have the administrative component, the business owner side of the coin. And guys, it's a lot of work. And I'll tell you, dental school does not prepare us for that aspect of our realities in the future. Having to worry about marketing, like even if you do hire firms to do these things, like the buck ultimately stops with you. So even if you hire a company to do these things, you have to stay on top of that company to make sure they're getting you the results that you're paying them for, right? So it's a thing. It's a ball that you have to juggle. You know, knowing your financials. And I'll tell you, if your blood turns to ice water at the mere mention of a spreadsheet, get over it if you want to own your own practice one day, because you have to soak in the numbers and the financials and the business aspect of this all. Then of course you have the clinical protocols, right? You're the dentist when you're there in the office, but you're also going to dictate the rules that the entire team is going to follow to do their jobs, right? The way you want them to do it. Because you don't want folks coming at you with every single potential little question they may have. Like, do I take this x-ray now or later? What do I do at every step of the way? So you have to lay out all of those rules so that you don't have to keep answering those questions time and time again. And then again, you know, what happens if the sterilizer breaks? Who do you think they're going to come get if it's your practice? That's right. You got to deal with that too. You know, you got to make sure that all of your equipment and the facilities are up to par. And let's not even get into the HR, because thankfully we can hire folks to handle most of that for us. But hiring, firing people, training people, onboarding them when they're new team members, it's a lot. It can be quite a bit. And like I said before, absolutely impossible without a great team. And this is part of my team here. It's good to see their smiling faces. So, ownership pros. You get to run your own life. And the cons. You don't really get to have one. I'll tell you, my usual admin days are Thursday afternoons, Fridays, usually Saturday mornings. But 24/7, 365, I am thinking about the business, right? It is just, it comes with the territory, right? To me, it's my passion. It's my hobby. I enjoy developing the business. I enjoy developing my team. So I really just can't get enough, whether it's reading a book on how to be a better leader, or actually right now one of our wildly important goals at the practice is developing a revamped operations manual before the end of the year. It's going to be about a 260-page document spelling out every single step of how to run a practice. And guess what, y'all? 260 pages takes a long time. So there's always something to do when you're the owner, right? But owning your own practice really isn't the only way to be a dentist. So let's talk about some of the other options. Associateship in private practice. We'll get into a little bit more of a few of these in just a second here. Managed care, which I talked about a little bit earlier, that was my quote unquote speed residency. And a managed care facility is going to be, for me specifically, it was Leon Medical Center. I'm sure you guys have seen the little buses running around, right? In South Florida, those sorts of institutions are really popular. They are Medicaid providers. So my population there, my patient pool was entirely geriatric, entirely old folks. Seeing a bunch of patients, doing a lot of surgery and removable prosthetics, so like dentures and partials and things like that. So that is definitely an option, a way to practice. It works for a lot of people as a career. You know, one of the beauties of it is that I punched in and punched out. And when I was done at 5 o'clock or 6 o'clock or whenever it was, I went home without a care in the world. I didn't have to worry about HR, about clinical protocols, about supply tracking, or any of that stuff. We'll talk a little bit more about DSOs or corporate dentistry. And understand, guys, like if you guys know a little bit more about this, I'm really trying to keep this as simple as possible, as just kind of like broad brush strokes. DSOs in particular, dental service organizations, can take on many, many, many different forms. But the most common ones are corporate dentistry, things like it can rhyme with, you know, grass pen dental, or Heartland, Greenberg. There's all sorts of different ones, right? Academia. You know, we can go into teaching. You can, I had a couple of classmates actually that immediately after school were hired on by UFCD as professors, and they're still there and they love it. And it's perfect for them. They enjoy interacting with the dental students, developing curriculums, and being really hands-on with that next generation, right? Public health, and we'll talk a little bit more about public health, a really great branch of practice. Clearly, we can go into research, and a lot of folks who do normally have an academic component to that, right? They'll do research under the auspices of a university, and they'll also have a professorship there, generally teaching dental research topics. International healthcare is another like really great branch of practice. Things like Operation Smile, I'm sure you guys have heard about. They do amazing work around the world. And for some people, that is their main way to practice. For a lot of us, it's a temporary thing. You know, we'll sign up a week or two here and there every few years to give back and really to have a super rewarding and cool experience. And actually, that's how I ended up meeting my wife. So it can have multiple different benefits. But yeah, it's got great opportunities in that front. Hospital dentistry is not super common, but there are dentists that work primarily out of hospitals in ORs. And specialty care, right? As you guys probably know, there are now 10 recognized specialties through the ADA, the most recent of which is dental anesthesiology. So if you're the sort of person that thrives kind of doing the same kind of work over and over and are comfortable doing that every day, then specialty care may be for you. Like I said before, I thought I wanted to go into oral surgery, but if I had one wisdom tooth extraction lined up after another, I'd probably jump out of a window. So let's talk a little bit about public health. Public health is one of those interesting ones where it's one of the 10 specialties. You can get a specialization in dental public health, or you can just go into the field as a generalist. So we can have an individual versus a population perspective within public health. Now, the individual, it's generally GPs or general practitioners that will go into either the VA or the Indian Health Service, which I'm sure you guys are familiar with. And those tend to have really great programs as far as loan repayment goes. I'm not sure what the current offer with IHS is, but when I was in dental school, 4-year commitment to the IHS basically paid off all of your loans. So, you know, it generally means you have to move to the middle of Montana somewhere, but if you don't really have any ties where you're at, maybe not such a bad deal. And now the population perspective of public health is really where the folks with the specialty come in. They generally tend to work on legislation to preserve and strengthen the dental safety net, develop programs for folks to gain access to care and things like that. So talking a little bit about what I call employment as a dentist. So here is where we have corporate facilities, DSOs. You see a group of very excited folks here with their white coats on, and the Grass Pen Dental logo in the back there. Now, the big difference between a private practice and a corporate sort of setting is that the business aspect of the practice is run from outside the practice in a DSO. All right, so you will have some mothership company, corporation that is making decisions for how the clinic component should be run. And they generally will profess that they don't interfere with the clinical decision making, and generally that is true. And although I haven't worked personally in a DSO, I do have many colleagues who have, friends and students, and I can tell you sometimes those lines get a little bit blurred in those environments, and it's a matter of financials, right? Like they are running the practice and the clinical care based off of spreadsheets, and there are quotas and sometimes sales tactics that some people may find a little tough to deal with. But it's the reality, guys, and that's what happens after we graduate, right? We're all saddled with debt. We have to find a job, and they do offer nice compensation packages and great flexibility. In one area in particular, things like maternity leave for smaller practices can be really, really difficult. So if you are looking to spend a lot of time with the family, maybe take time off, if you do have kids, things like that, this can be a great sort of fit, because you can take 6-9 months off, and they will generally, if you're in good standing with the company, have a position for you when you're ready to go back. So a downside is that there does tend to be a higher volume of turnover, not only in the clinical team, but in patients as well. So some of that the patient relationship sometimes isn't as strong in settings like that. So we'll talk a little bit about associateships, and this is really the holy grail, so to speak, of getting a job after dental school. The ideal sort of scenario would be to get a job as an associate in an established practice with a doctor that's going to serve as a mentor, right? Who's going to be with you during your early clinical times to answer questions and kind of hold your hand and provide answers not only clinically, but professionally. Like sometimes patient management stuff can be really hairy and tricky, and having someone to bounce ideas off of is great. And another really helpful thing is providing a roadmap of CE. Like I said, when you graduate dental school, you have a license to start learning, right? And one of the most effective things, along with training your team, if you do open up your own practice, is training yourself early on. Like getting as much education above and beyond what you got in dental school as you possibly can. Learn how to do advanced procedures, learn how to do the Invisalign, learn how to do sleep medicine, learn how to do implants. Really that's what keeps you growing as a professional and keeps you at the forefront of the field. Now, in private practice, one of the beautiful things is that you develop those relationships with patients, right? Like we see patients for generations. And it's really rewarding to have families that trust you and develop such a bond with you as their provider that they will send their family members, blindly to you. They trust in you, and that's kind of a sacred responsibility, y'all, and something that really happens with time when you get to see those patients over and over and over. So whereas in a corporate setting, maybe, they don't have their dentist. If a patient goes to an Aspen Dental and they see Dr. Smith for their new patient exam, they may see Dr. Jones for, the procedure. And then they may see, Dr. Abrams for the post-op for the procedure. So developing those bonds and that rapport with the patients, which is really a super gratifying, rewarding thing of the profession, is difficult in those settings. As an associate, your compensation is usually production driven. So it's a percentage of how much you produce. So if you're super duper slow and you can only see 2 or 3 patients a day, you're probably not going to make as much money. But at the flip side of that is that you'll probably have someone holding your hand, helping you get up to speed. In the corporate setting, yeah, you may get that higher compensation package, but after 3 months, if you're not delivering, they may just show you the door, right? And it's back to square one for you. And no doubt about it, with the associateship in a private practice in this sort of like dream world scenario, the goal would be to eventually earn partnership, right? And when you become a partner in a practice, you become part owner of the practice. Sometimes that can be structured a little bit differently, and partnership doesn't necessarily have to mean ownership, but it generally does. And this picture here is my future associate. Her name's Sarah. She is currently a D2 at UF. So when she graduates, she'll be joining the practice and helping us grow. Very proud of her. Very proud. So let's talk a little bit about interviews, tips and tricks, because acing interviews, simply one does not. It is kind of a stressful time, y'all. I get it. For those of you that are, and especially now during the pandemic, where many interviews are via Zoom, it's kind of different, guys. It's a big wrinkle. But let's talk a little bit about what to expect in that day, because this is a topic that's really near and dear to my heart. I don't have any tangible evidence, but I have it on good authority that, as I said before, I was kind of an average applicant. It was really my interview that helped me slide into dental school. So very near and dear topic to me. It's super important, guys, that we keep in mind that the interview is really an "Are you human?" interview. Like, an interviewer is looking to get to know the people applying to their school as individuals, as people, not as statistics on a piece of paper. They have all that on your application, right? They have your GPA and your DAT and how many hours you shadowed and all of that good stuff. So it's not a conversation to go over those things again. It's a conversation about your emotional intelligence, right? And what all of those experiences and trials and tribulations mean and how they've shaped you as a person to be a great dentist in the future. Okay? So without a doubt, there are tons of lists out there with top questions asked during a dental school interview, professional school interviews. No doubt, like, work on those questions, work on the why dentistry, because they're going to ask you that. If not explicitly that way, they are going to ask you why you want to be a dentist, and you should have a good answer, right? It should be a well thought out, thoughtful, meaningful answer. Now, don't go overboard. Okay? Don't sell it too hard. Be yourself, right? But have a good answer. Another very common question is tell me about yourself, right? Interviewers sometimes will start with that just to sort of break the ice. And this is a golden opportunity, guys. This is where you guys get to lead the conversation. So think about those scenarios before you present for the interviews, right? Think about what you're going to say when they ask you those questions. And like I said before, like, be meaningful, think about things, give them a thoughtful response, but don't try and overscript things. It just comes across as like contrived. And again, they want to get to know you as a person. Now, some questions are toss-ups and some questions can be really, really hard. I got a couple of these questions and it sort of threw me off. But what's something you would like us to overlook in your application? Like, how do you answer that, right? Like, you have a gaping hole, have a good answer for it, right? Have a reason why you have that gaping hole, but see those opportunities, see those questions as an opportunity to sell yourself, right? Like, as hardline as that question seems, a good answer to that question is gold to that interviewer. Right? If you take that difficult, that sort of negative on your potential negative on your application and reframe it with a growth mindset to that interviewer, I guarantee you they are going to see you as a very, very, very good potential dental student and future dentist. All right. So what we talk about really, I don't know, maybe some of you are familiar with the STAR method, but it's an acronym for STAR means situation, task, action, and result. Like, when you guys have these difficult questions that you're being asked, think of those potential questions and frame out the answers following these 4 steps. So situation means the event, like, right? I'll use an example that I wrote about in a letter of recommendation for one of my dental assistants who's currently applying to dental school. Her name was Heather. When she started with me, she was having a very, very difficult time taking alginate impressions, okay? And taking impressions is a core fundamental aspect of dental assisting, of dental school, of dental practice, right? If you can take a good impression, you have the hand skills to do many, many things in dentistry. And she at first did not. So her situation was she was struggling taking impressions. Her task was just that, taking dental impressions. And what she did was she gathered all of that materials, all of the equipment that she would need it. She took it home over the weekend and she practiced like hell over the weekend. She came back Monday and she was a rock star. She was mixing alginate faster than my other assistants. She was taking impressions better than the other assistants. And it was a remarkable turnaround. And what was a negative was now a highlight in her application, something that she got to talk to, you know, in her personal statement and so on and so forth. So taking that STAR method, situation, the task at hand, the action that you took on, and then the outcome of that is super important. You know, don't leave it at, oh, tell us something you'd like us to overlook. Like, oh yeah, maybe those 6 months that I didn't really do a whole heck of a lot of anything. And then just leave it at that. Like that's interview suicide, right? Follow the story through. Like you're pitching yourself via a story to these schools, okay? So give them that closure to the story that they want. Give them that end positive result, okay? So a couple of other tips for interviewing and interview day. Guys, be nice to everyone. The person scheduling the interviews. If you have an in-person interview, the janitor that you walk across, right? Like this is a suggestion for life. Like we should walk around being nice and courteous to everyone, not just because we hope to get into dental school. But in the context of applying and interviewing for dental school, you never know how it's going to get back to the committee, how you behaved when you were outside of the interview room. Okay, so keep that in mind, guys. Manage your nerves. Okay, my wife is an interviewer for med school, and I've gotten a lot of the information and tips that I share with you guys with our DMD bound students through her. She actually teaches one of our courses on preparing students for the interview. Guys, they know that we are nervous. All right. When you go to those interviews, they expect you to be nervous. And if you feel that those nerves are kind of getting away from you, a great thing to do is to acknowledge those nerves, right? Just lay it out on the table. And if you feel like your voice is jittering and your palms are sweaty, like start off the interview by saying, I'm really nervous. And then add on an awesome compliment to them and the school and say, I'm super nervous. It's just a huge honor to be here, right? So now all of a sudden you spun them, you make them feel great, right? Because who doesn't like to be, in the presence of someone who's honoring the fact that they're with them? And you're just sort of getting it out there, right? I'm nervous. Yeah, I'm nervous. And I may stumble. My voice may shake a little bit. But man, I'm really, really excited to be here, right? Put your best face, and if your interview is via Zoom, your best place forward, okay? Bear in mind that when they are looking at you, when they're looking at you on a screen, they're looking at not only you, but your background, okay? So if you have a big poster of Bob Marley smoking weed in your background, that may be super cool, but maybe for the interview, take it down, right? Set the stage for the background that the interviewer is going to see, because I literally heard that happened to an interviewee And it's just like, what are you doing, right? Like you're asking for reasons for this interviewer to put you on the denied pile. All right. So run through it, like get people's opinion, get on Zoom calls with folks, maybe people who have professional experience and have professional Zoom meetings, and ask them to judge and rate your background. How do you look on camera? Like dress nicely, right? Prepare yourself, put your best face forward too. Make sure you get a good night's sleep. Don't do anything that you wouldn't normally do, right? Before the day of the interview. And make sure you show up on time. Set multiple alarms if you have to. Don't sleep through your interview because that's an automatic no too. All right. Closing with class, always, sending a thank you note, thank you email. That's just a classy thing to do. It brings you top of mind again a few days after your interview and just really kind of seals it off with a really nice touch. And very generally, very commonly, interviewers will have one final question, and that is, do you have any questions for me? And you should. You should think of a couple of questions to have. And they should be easy questions to have. They should be questions that are, allow the interviewer to paint themselves and their school in a very positive light. If they recently had their accreditation come into question, don't ask them about that, right? Don't ask them any hard questions, anything that is going to potentially, put them in the weeds. And number one piece of advice, when all else fails, everyone's favorite topic is themselves. If you can somehow find a way to get that interviewer talking about themselves, whether it's their professional accomplishments or, the school that they work at or anything like that, that is just a law of nature that we all like to talk about ourselves. So ask them easy questions, ask them things about themselves. Again, easy things to answer where they get to really shine. And you're probably going to gain a little bit of bias with that. All right. So I'll close it off here, guys, with a quote from one of my favorite MMA fighters, Uriah Faber. He said, "Dream big, stay positive, work hard, and most of all, enjoy the journey, guys. Every step of life is a journey. Everything worth having presents obstacles. So just keep trucking, y'all." This is my contact info here. I'd love to hear from you guys. I love working with pre-dental students. If you guys want to drop me a line, you can email me at hello@dmdbound.com. And my team will forward that to my attention. And one thing that I wanted to just bring to y'all's attention, through our DMD Bound program, we are starting a Community Smiles initiative. And this is going to be a program where graduates of our DMD Bound program that have their expanded functions dental assisting certification will be they'll be the providers for free dental days. So what we'll be doing is doing free cleanings on underprivileged kids in the community. And it's something that we're really, really excited about. We hope to host our first event either in December or January. And if you guys have any questions or interest about that, the point of contact is going to be one of your fellow Pre-Dental Society members, Gustavo Matos, and you guys can reach him there at gmato@009@fiu.edu. So if you guys want to write down my email address, any questions that you guys have, I am always happy to work with y'all. So with that, I'm done talking. Have you had enough? So if we have any questions, more than happy to stay on here with you guys. And yeah.
Dr. Alex, I have a question.
Yeah.
You mentioned implantology, and I know that isn't a recognized specialty. How
Correct.
would one go about practicing implantology?
So that is a great question. You have to be trained, right? And you can either gain that training in dental school or when you're in or as CE, right? You can gain, there are fellowship programs for dental implants through different organizations, a lot of advanced training. There's tons of great resources out there and great options to gain the training needed to perform dental implants.
Thank you very much.
Yeah, absolutely. Thanks for the question. I like your background, by the way.
Thank you.
That's right.
Sorry, I have a question. Can I have a question?
Go for it.
Okay. Okay, so I was told that if a dental student wanted to pursue general dentistry, residency wasn't necessary.
That's correct.
Okay. So is this like your personal case?
That is my personal case. Yeah, that's what I call my speed residency. I didn't do a formal residency program. There are 1 and 2 year general dental residency programs out there. I opted to go straight into the workforce, and that's where I did my 1 year at the managed care facility and really got my speed up.
Okay.
Yeah, I did not do an official residency program.
Got it. So were you familiar with the people at the practice that you got your residency from?
I applied for a job. Yeah.
Oh, okay.
I did not have any inside track coming out of dental school for any sort of dental position at all. The dentists that I had shadowed and had the closest ties with weren't hiring. So those personal relationships didn't really, get my foot in the door, so to speak. I applied for jobs.
Got it. Okay. Thank you.
Yeah.
Dr. Alex, good evening again. Thank you so much for this presentation, firstly. Sorry. My question was personally, you said how you work 3.5 days a week, right, typically. For you, well, firstly, is that a common thing for people in private practice to just do 3.5 days a week?
It's certainly more common than doing 6 days a week.
Mm-hmm.
Yeah, I think the latest statistics that I saw, the average dentist works about 4 clinical days a week. Mm-hmm. Average GP, that is.
Gotcha. And also, like, what do you do outside of being, a practice owner to keep you sane? That's
a great question. Like I said, spend time with my people, my best friends, my wife, and my son, Jordy. Our current go-to is taking golf cart rides around the neighborhood. We just got a beater of a golf cart, and we really like tooling around the neighborhood with it. First thing my son asks for when he wakes up in the morning is, "Can we take a ride?" So we'll hop on, and yeah, we'll just have fun, guys. Really.
Awesome. Thank you.
Yeah. Let's see. I see a question here in the chat. Is Sage Dental a DSO? Yes. Sage Dental is one of those corporate dental facilities like Aspen's and Heartland's and so on.
Oh, okay. Thank you.
Mm-hmm.
Here's a question, actually. If you could change one thing about your dental journey to today, what would you change?
That is a phenomenal question, Alex. So I honestly think I jumped into practice ownership too soon. If I could go back and do it all over again, I would focus the first handful of years of my career and devote that toward learning dentistry, really. Like developing my clinical abilities, my diagnostic abilities, right? Our day-to-day dental hat. I was maybe, bit off more than I could chew at first, learning how to be businessman and be dentist at the same time. So I think splitting those two things up would have been helpful.
Awesome.
Yeah,
And
thanks for that. Great question.
all good. And kind of going off that, I know that a bunch of schools offer a program where you can get your dental degree as well as like a business kind of degree as well, an MBA maybe. What is your view on that? Do you know people who have been through that process, and have they said that it's worth it or it's not worth the extra years in school? Or?
Yeah. The MBAs in general, guys, have lost within the business entrepreneurial community, have lost a lot of luster. It just, yes, you're going to learn spreadsheets, and you're going to learn what a P&L is, and you're going to learn what a balance sheet is, and you're going to learn how to read those things. But unfortunately, that is such a small aspect of what running a business is, right? Like running a business is like very much like the dental field, a people thing, right? And managing the team and developing the team and all of those things are far bigger component of running a business than the financial forecasts, so to speak. So, I mean, is it going to hurt to have an MBA along with your DMD? No, absolutely not. And it'll look really cool on your business card.
Awesome. Thank you.
Yeah. Dude, don't you have a game going on right now?
I can hear the announcer in the background. I can hear the announcer in the background, yeah.
Okay. Any other questions, guys?
Just would you like to talk about any of the cases that you've had recently that you found the most interesting, or that I don't know, were somehow like different from like the day-to-day basis, like the normal cases?
Sure. That's kind of hard to do with no visuals though. One in particular right now that is actually consuming a lot of my bandwidth, because I'm trying to figure out a better way to go about it, is long-term patient, kind of fell off the face of the earth for a while, came back, shared that he had been diagnosed with pharyngeal cancer, right? Went through the whole process, the treatment, chemo, the radiation. And I don't know if you guys are aware, but head and neck radiation is disastrous to our oral health. And specifically because it completely eliminates salivary flow. And saliva is really, guys, what keeps the mouth healthy. Without saliva, our gum health, our dental health declines very, very, very fast. And that was the case for him. He already had a complete upper denture, but he had a lower tooth-supported bridge that replaced, he was missing maybe half of his lower teeth, but they were all replaced by a single bridge. And guys, every single one of those teeth holding that very expensive bridge up rotted to the gum line. So it's a very, very, very difficult sort of scenario. He still has his trach, right? His tracheotomy, planning on having that removed in the next couple of months. But this guy now has no lower teeth, so he can't chew. And between the chemo and the radiation, all the treatment he's got no teeth, so he can't eat. The man's lost a ton of weight. But in order to really start replacing any of those teeth, like, there are a lot of steps that need to happen, right? Like, we can make him a lower denture for now to sort of get him by, and that's what we've done. But he needs something a little bit more stable. Like, if any of you guys have shadowed any prosthodontists or general dentists that do removable prostheses, dentures, you guys know that a lower denture is an absolute nightmare for patients. They call it a ballerina because it's always dancing around inside the mouth, right? It is just a very, very uncomfortable appliance to function with. So the man wants something more permanent, and I don't blame him. Now, what happens is, for these head and neck radiation patients, they are not good candidates for a very, very long time and under very strict protocols to have any sort of oral surgery. So all of these teeth that have rotted out, we would like to transition him to implants, but simply taking those teeth out puts us at a very high risk for what's called osteonecrosis or death of the jawbone, which is a very, very difficult situation to manage. So we don't really think that he is currently a good candidate for any sort of oral surgery. So what I've been working on is using those rotted out teeth that he has as potential anchors for his lower denture. And I'm actually going to be doing a procedure that I've never done before for him to basically turn those stumps of a root that he has left in the jawbone almost into like biological implants. So we're going to clean out the decay that's there. We're going to be doing root canals on all of those teeth, and we're going to be inserting posts in those teeth with attachments on them that lower denture will snap onto. So will it be a long-term definitive sort of solution for him? Probably not, but it's going to carry us far enough to where his overall health will stabilize and potentially open the door for us to do something a little bit more permanent. So I wish I had pictures of all that because it'd be a hell of a lot more interesting than me talking about it, but you asked.
No, I mean, that's really interesting. I feel very bad for him. I have family members that had like full dentures, and they really, they really struggle with it.
Yeah, it flat out sucks.
Yeah.
A C over C, as it's called, meaning a complete over a complete, two full dentures. If you don't have something holding those dentures in, you're never going to chew the same again. It's really a suboptimal solution.
Yeah, I hope his health stabilizes.
Me too.
I believe someone asked a question in the chat recently.
What kind of partnership is my company? Cassandra, maybe you can elaborate on that a little bit.
Are you a general partner or just like a regular LLC? That was my question, kind of.
Okay, so you're talking about the corporate structure of the business,
right? Yeah.
It's an S corporation.
Okay.
Yeah, and you're right. You don't really learn these things in dental school. You would learn this if you got the MBA, though, Alex. So you can have LLCs, you can have corporations, and those corporations can be either S or C corps. You can have a solo or a partnership type of corporate structure, and they all have different advantages and disadvantages, right? And a lot of that has to do with how you're going to be structuring your taxes and things like that. So definitely having a very competent accountant on your side when you start thinking about developing and starting your practice is one of those key individuals that you want to have in your corner.
Thank you so much for answering that.
Yeah.
What were the steps that you took to hire like your team? Did you just go online and search for them, or how did you go about doing it?
That's a really good question. That has evolved over time. It used to be that, so when I first bought the practice, I inherited the team, right? It was a team of 4, including myself. I had a part-time hygienist, I had a full-time assistant, and I had 1 front desk. My assistant quit 2 days after I bought the practice via text message at 2:00 in the morning. And I have it on good authority that she did so from Roundup, a Western bar up in our neck of the woods. But yeah, at that point I was brand new, had no idea what I was doing. And now I don't even have an assistant to run the show. So there are services out there like ladders.com or monster.com that are job posting sites. There are some of those that are specifically geared towards the dental community. And that was my first stop. It's called Dental Post. I went on there with my office manager at the time, and we looked for someone. And this was part of that, learning how to run a business as we went along, right? Learning how to properly screen applicants, learning how to interview, and how to ask questions that give you insight into who you are interviewing to bring them and make them a part of the team that you want to have. But it's not an easy process. Hiring is not easy. Firing is a lot harder than hiring is. You know, anyone who's ever broken up with someone knows that that's a tough conversation to have. And firing someone's a lot like breaking up with folks. You know, it's not you, it's me. Sorry. But yeah, it was a lot of trial and error. A lot of trial and error. And my absolute favorite question to ask people on an interview is, what is your favorite book and why? I feel like that one question has given me more insight to my team than anything else. So maybe be ready to answer that question too.
Somebody asked a question in the chat asking if you allow shadowing at your practice.
Thank you for that question, Stephanie. Unfortunately, we do not at this time. And that is simply because with our DMD bound program, one of the core features of that is an in-office residency. So because we have our students in the office, we really like to devote all of our time and attention to those students as opposed to allowing other folks to come in and shadow. But thanks for your question. You can find a whole lot more information at dmdbound.com. You're welcome.
I think the meetings run pretty thin right now with participants. So
yeah.
Unless anyone has any questions that they've been holding back for last, then I'll give it a second. All right. So I think we're good for the evening. Dr. Alex, thank you so much again for allowing us to have your time to really speak to us about your practice and your story and everything in between. But I just want to say thank you about for everyone. And yeah, I guess we're dismissed.
Awesome. It was a pleasure, guys. Good luck to everyone. And again, if you guys have any other questions, reach out to me. hello@dmdbound.com. This was a lot of fun.
Thank you. We'll do.
Go Panthers.
Yeah. We're losing 7 to 0.
Oh, no. All right, guys. Go turn it around, Alex.
All right. Absolutely.
Bye.
Take care.
Take care.
Take care.